by motor neurons, so not the autonomic nervous system, at least not usually, right? At least not when we are cognitively aware. There are times during sleep or during deep rest where the autonomic nervous system can take over, but for the most part, we've got motor neurons increasing their neural input, and that creates the contraction of the diaphragm and the external intercostals, okay? So someone's asking, so I'm just going to pause here before I get too deep into this. They're a bit confused with what transpulmonary pressure is. Transpulmonary pressure is the distending pressure. It's a difference between the intraalveolar pressure, so the intraalveolar pressure minus the intrapleural pressure. And so we'll talk about it in another slide coming up, but it's basically representing how easy it is for the lungs to expand or to distend. Okay, and that's why the pressure the pressure in the intrapleural space is inversely related to that transpulmonary pressure. Okay, in other words, the more negative pressure, the more suction we have in the pleural space, in the pleural cavity, the easier the lungs can expand. The less suction we have or negative pressure in that intrapleural cavity, the harder it is for that expansion to take place. Someone's asking another question here, another follow-up question, explaining why inspiration is negative. So I'm going to try to explain this again by talking about why we zero out that atmospheric pressure, okay? I think that's where the confusion is. So we can think about the actual atmospheric pressure. In other words, if I were to measure the pressure in the atmosphere around me, that would be roughly 760 millimeters of mercury if I am at sea level, okay? If I get higher than sea level, that value goes down. If I go lower than sea level, if I go below sea level, that value goes up. And so because that value can change depending on where I am in the atmosphere, right, what my altitude is, then it's just easier to make that value zero and then think about our actual physiologic pressures relative to that zero, okay? I think another aspect of the confusion is that these pressures are negative. They're not actually negative. We're looking at them in a relative way, and so we're measuring them. We're thinking about them as being negative relative to our zero. But if you were to stick a pressure reader into your lungs, these pressures are not actually negative. They're just negative relative to our zero. Okay, and that's why it's so important that I put those absolute values so that you can understand that these are actual pressures, but they are relative to our set point of zero. And so in order to accommodate inspiration, those pressures have to be negative because they have to be less than zero. In other words, they have to be less than atmospheric pressure. Okay. Someone is asking, what is our zero? What is our zero in our physiology? There's no zero in our physiology. Only time that that value becomes zero is when we're at rest, okay? In the atmosphere, we've set it at zero, although it's not actually zero, it's 760 millimeters of mercury at sea level, right? And when we're at rest, we're gonna think of it as being zero because it's the exact same as whatever's in the atmosphere, but it's not actually zero, okay? Please feel free to bring up other questions. If there are other points of confusion about this, please feel free to bring those up. So it's a kind of abstract way to think about this, right? These are actual pressure values, which we talked about, like 760, 758, 754, but they're only what happens at sea level. And in actuality, we're not all at sea level. In fact, Duluth is a city that's quite far above sea level, okay? And so our pressures are not gonna be 760, they're not gonna be 758 because we're not at sea level. And so the easiest way to think about that would apply to us regardless of where we are in altitude is to just make that atmospheric pressure zero and then think about our pressures relative to that zero. So when we are at rest, because our alveolar pressure is the same as whatever the atmospheric pressure is, we think about our alveolar pressure as also being zero. In actuality, it is not actually zero, okay? I hope that made a little bit of sense or some sense. Okay, so continuing on here with this flow chart, we're looking at the flow of events. So we're starting off with neural input from our motor neurons that causes our inspiratory muscles, which are diaphragm and external intercostals, to contract. And then we see the chest wall expand. So as the chest wall expands, remember, think about the orientation of those muscles. So the external intercostals for one, pulling the rib cage up and out, the diaphragm flattening out in its contracted state, that expands the space within the thoracic cavity. Then we see the intrapleural space, the pressure there, that creates a pull on the intrapleural fluid, okay? That increase in that intrapleural, that increase in the pull on the pleural space. So what I'm trying to say here is that there's a connection between the chest wall, which is adhered to those muscles, and the diaphragm in the inferior aspect, and the pleural space. So as the chest wall expands, it pulls on the intrapleural, the pleural cavity, and pulls on that pleural connection. That is going to decrease my intrapleural pressure, okay, which is the pressure around or within the pleural cavity, the pleural space. That is going to increase my transpulmonary pressure, right? We just described that there's that inversely proportional relationship between intraalveolar pressure, between intrapleural pressure and transpulmonary pressure. And just to kind of illustrate that here, right? We said transpulmonary pressure is alveolar pressure minus intrapleural pressure. And so if this value goes down, this value goes up, okay? So as I pull by that pleural connection on my pleural sac, pull on the intrapleural space, I drop the pressure in that cavity, remember, increasing the volume, decreases the pressure. And so that is going to result in an increased transpulmonary pressure. And we know transpulmonary pressure represents the ease with which the lungs want to distend. And so if I raise my transpulmonary pressure, the lungs are going to distend quite nicely. The alveoli are going to open up quite nicely, okay? And so that's what we see. The alveoli now can open up. That's going to increase the volume or the space within that alveoli, the alveolus. And then as the volume goes up, the pressure goes down. So this is Boyle's law, right? We talked about this. This is Boyle's law here. If I increase the volume or the space of my container, I drop the amount of pressure in that container. So as I pull on those alveoli, because of that pleural connection to the thoracic cavity, I increase the volume, I decrease the pressure. And then as I decrease the pressure, I now have a gradient. I increase my gradient. So the atmospheric pressure minus the alveolar pressure is our gradient, and that can accommodate inward airflow, okay? Now, as I move air in, remember thinking about our explanation of the fact that as air comes in to the alveoli, pressure now increases. So the two factors that influence the pressure within the alveoli are one, the volume of that container. As volume goes up, pressure goes down. So we start off by seeing a drop in pressure, which is accommodating that airflow. But then as air rushes into the alveoli, the number of gas molecules changes and then pressure goes up, okay? That's what creates that curve and gets us back to zero. So we go from 0 to -2 down here and back up to 0, okay? And this is inspiration. And then we can turn off, so that's sort of a negative feedback here, because as the pressure raises once again within the alveoli, we no longer have a gradient for airflow, and that brings us to rest, which is sort of the midpoint of the respiratory cycle. And then from here, which is 0, we then increase our pressure, right? So the change that's responsible for expiration, although it's not shown here, is going to be a curve in the opposite direction. We're going to go up to +2, right, which we just drew out. And sorry that I'm drawing across this, this thing here, but then we're going to go back down to 0. So this is inspiration, pressure drops initially because volume goes up, but then as air comes in, pressure goes up as well. we get back to 0, and then we reverse the direction of our gradient. So we go from 0. This time the volume of the container gets smaller. So think about the relaxation of those inspiratory muscles, diaphragm, external intercostals. They relax to their original shape. That shrinks the size of our container. And as volume goes down, again, according to Boyle's law, pressure goes up. So this is what's causing that initial raise in pressure. But then the drop in pressure that we see is because air is leaving the alveoli. So here we begin to facilitate the gradient so that air moves out of the alveoli. And then towards the end, as those number of gas molecules decreases, so does pressure. So we see this drop off in pressure until we get back down to 0. All right, so we go from 0 to -2 to 0 to +2 to 0, on and on throughout those different phases of the respiratory cycle. Okay, I hope that was clear. Now, this slide here kind of explains a little bit more what that transpulmonary pressure is, okay? So we're seeing here, we've got our alveolus, we've got the intrapleural space here. And so the transpulmonary pressure is the difference between the pressure inside the alveoli and the pressure in the intrapleural cavity. And it's going to also represent the distending pressure. I keep mentioning that word. It's how easy it is for the lungs to distend. If my transpulmonary pressure goes up, the lungs really want to expand. They really want to distend to accommodate airflow, inward airflow. And if we think about our graph down here, we've got our pressure relative to atmospheric pressure. Okay, so this is basically, again, showing a pressure change. And so we go from 0 down here to -1. Now this is showing a different value in terms of a different change than what we drew out, but it's the same relationship. So we go down to -1. And as we can see here, the intrapleural pressure is also decreasing. But remember we said when intrapleural pressure decreases, the change, the difference is going to be greater. So the difference is greater here. In other words, we have a larger transpulmonary pressure here because it's the difference, right? So as this value goes down, transpulmonary pressure goes up. So the lungs really want to distend in this phase. But as intrapleural pressure goes up, the difference again gets smaller, right? Alveolar pressure minus now a bigger number. So this overall value goes down. And so the lungs do not want to distend during expiration. So I'll say this here another way. That transpulmonary pressure is the difference between intraalveolar pressure and intrapleural pressure. In other words, as my intrapleural pressure goes down, my transpulmonary pressure goes up and my lungs really want to distend. As my intrapleural pressure goes up, my transpulmonary pressure, right, that difference goes down and my lungs do not want to distend, okay? And we can also see how volume is changing here at the bottom. So here we're bringing air in, which is being accommodated by that increase in transpulmonary pressure, making it really easy for the distension of the lung. Whereas here we're moving air out. And so we're reversing that transpulmonary pressure. Now it's decreased or lower. And so here the lungs do not want to distend.